Hey you guys, coming at you from my home office here. Just going to be doing a podcast for Professor Stan Rialey's Health Policy and Management course at Herzing University. So I'm just going to start by kind of introducing myself. My name is Kate. I am a nurse in Wisconsin. I've been a nurse in the emergency department for 3 years, and I was a critical care transport ground and flight paramedic prior to that for 5 years. I have started with my ADN, gotten my BSN, and then now obviously I'm working on my master's. So that's kind of my background in nursing. And today I'm going to talk to you about educational attainment policies, and I guess I'll outline, we're going to kind of discuss what it is, the types of nursing degrees that you can have, pros with educational attainment, cons of educational attainment, my personal experience that I've had, and then maybe some different changes that we can make to kind of help support nurses and grow nurses and make sure that we are taking care of our own. And then we'll have a little area for questions and answers, and then I'll kind of recap. So bear with me here. I do have my other screen up here so I can look at my information that I gathered for the project, and let's get started. So when I was looking into educational attainment policies, there are loads of information on the internet. So kind of have to sift through it, make sure you're getting really accurate information. But what I found that I thought was really cool was this quote that was from the American Association of Colleges for Nursing, which is a national academic nursing voice that believes that education has a significant impact on the knowledge and competencies of the nurse clinician, as it does for all healthcare providers. Clinicians with Bachelor's of Science degrees in nursing are well prepared to meet the demands placed in today's nurse. BSN nurses are prized for their skills in critical thinking, leadership, case management, and health promotion, and for their ability to practice across a variety of inpatient and outpatient settings across the lifespan. Nurse executives, federal agencies, the military, leading nursing organizations, healthcare foundations, magnet hospitals, and minority nurse advocacy groups all recognize the unique value that BSN nurses bring to our practical setting. And I felt like that was really a cool and all-encompassing quote that kind of discusses how bachelor's prepared nurses can really bring some really great qualities to the nursing field. So with that being said, I think it's important to kind of understand the different types of nursing degrees that are out there. So for any of you guys that are not nurses, who are looking into going into nursing, kind of feeling out what hospitals and organizations are expecting of nurses, this is a really great understanding. So obviously, like I said, I started out as an ADN, so an associate degree of nurse, which is a 2-year program. For me, I actually got it done in 1 year because I had prior prereqs done and kind of did a fast track route with my previous healthcare experience. So that was really beneficial. It just covers basic nursing knowledge, prepares you for the NCLEX, and kind of helps build those skills that you're going to need as a nurse. It does go over some basic pathophysiology, pharmacology courses that you're going to need, but certainly not any of the other cultural classes that you would get with a BSN. So the next step is obtaining your BSN, and that's actually what a lot of healthcare organizations are going for, and that's kind of what this whole podcast here is about today. And the BSN degree is a 4-year degree that not only encompasses the nursing aspects, but also does religion, music, politics, a lot of your other things that make you a more worldly nurse, and kind of helps you understand the differences in caring for the whole person. So those are really important classes, and that's why they are taking a little bit longer with those 4-year degrees, is because of those other classes that you have to take. Next up in the kind of course of study is your MSN, which is what most of us are doing in Professor Stan Realey's class. So the MSN, I was pretty intrigued when I decided that I wanted to go back to school. I really wasn't sure what I wanted to do, and I started researching, and there are tons of specialties that you can do when going into your MSN. So I'm just going to look these up. So MSN, when I found master's level nursing courses, the ones that I thought were pretty cool were the clinical nurse specialist, psychiatric nurse practitioner, family nurse practitioner, CRNA, midwifery, gerontology, education, and leadership. So there are a plethora of things that if you want to continue your education as a nurse, there is a way for you to do that. And you can pick your specialty and just go full-fledged with it. It's pretty cool. So I really encourage everyone to continue pursuing education. That's great. And then after your master's degree, you can certainly do your DNP, which is just additional education. It's your doctorate of nursing. And a lot of those courses are an additional 2 to 3 years after your master's. So with that being said, let's kind of go back and focus on the attainment of that nursing education. So a lot of hospitals are hiring ADNs, associate degree nurses, and then what they're expecting is that those nurses become bachelor prepared nurses within a certain amount of time, which is reasonable. And when I was looking into that, I was like, there are a lot of pros and there are a lot of cons, and I can see both sides of the story. So when I did my research, I came up with some kind of common themes that I thought were good pros and good cons to kind of look at in my personal opinion. So the pros that I found with that is with a bachelor's degree, you can truly obtain any entry-level nursing degree, any of them. You will meet all of the requirements needed to be a nurse in any facility. Additionally to that, you can pursue leadership and management areas of work, which associate degree nurses cannot do. Most of those leadership areas require that you have taken classes in economics and religion and those other kind of what I used to refer to as fluff classes that actually make you a better nurse. I was really quite surprised. Another pro is that you can continue on with your master's degree, which most of us are doing. You can't do that with an associate's degree. You have to kind of take those steps to get your bachelor's before you can obtain your master's. And then when I was looking at cons to educational attainment, they were mostly fiscally oriented, which I was kind of surprised, and that's really, really pretty sad. So what I found was that ADN and BSN nurses truly make about the same amount of money. If there is a difference, it's about $1 to $2 more an hour for bachelor's degree nurses, which really makes it tough because another theme that I saw was that people did not want to obtain their bachelor's because the cost of the education is so high. So that student loan debt accrual is huge. And when you're not really making that much more money, it is hard to pay off those student loans. And I think that most of us can definitely relate to that. I think it's difficult, and not everybody's in a good place. And then another one was that with that 2-year degree, that associate's degree, a lot of times people are going back to school as adults, and maybe they've lost their job, or maybe they have a family to think about, and they are trying to get this nursing degree done in a timely fashion that, will help them provide accurate income for their family. So that was another thing that kind of was of a con to educational attainment of the bachelor's degree. And then I guess when I was thinking about this, I thought to myself, what is my personal experience with that? And I guess when I went for my bachelor's degree, I was surprised. Where I work currently, the policy for educational attainment says that we will hire an ADN, no questions asked. As long as you pass the NCLEX, you are registered in your state, we'll hire you. It's great. However, you do need to obtain your bachelor's degree within 4 years of hire, which, when you think about it, it takes 2 years going full-time. to 18 months to 2 years to obtain your bachelor's degree. And most of these coworkers that I work with, these colleagues, are going part-time because they have kids, they have families, they are working full-time. And so to obtain that within 4 years really seems like a pretty short time if you think about it. So that was something that I thought was like, I'm glad that I had time. It was wonderful. My coworkers helped cover shifts for me to make sure that I could go to my clinical sites and that I could do my homework. My work was fantastic about it. But I think about other departments that maybe aren't so lucky, or people who work Monday through Friday who, have these clinicals to do and truly no time to do it. So when I was thinking about that, I feel like that was something that could definitely be improved upon. And then another thing that I thought was really interesting, I guess, as I talked about before, when you go for your ADN, you do cover pathophysiology, pharmacology, basic nursing skills, which I think is great. You can pass the NCLEX, no problem. But I really truly believe that if we want to make better nurses, in addition to taking these religious classes, these music classes, these classes that are going to help us obviously provide good care to our patients and holistic care to our patients, I think that one improvement that could be made is maybe taking those areas of focus of the body and breaking them down even further than what we did in pathophys or in pharmacology, and really kind of, once you have that nursing basis, building on that. So say have an additional class on cardiac rhythms. I mean, when I was in nursing school, I guess I was shocked at the amount or lack of amount of cardiac rhythm education we got. I was like, well, I'm a paramedic, I can read a 12 lead. And in nursing school, that's not how that went. We covered basic things, but I think, taking that and building upon that, say, hey, this is what we know you learned, and this is what you needed to know for the NCLEX, but let's take that one step further. Same with management of abdominal injuries or vascular injuries or any type of thing that's going on in the body, stroke, heart attack, and really delving into those things a little bit more, because I feel like, in nursing school, you truly don't have that much exposure to what is going on or what you're going to see as a nurse. And then when you get that basis and you're taking care of patients and you're putting all these pieces of the puzzle together, it's like, holy cow, that's so cool. And then you want to learn more about that. And while I know it's our responsibility to, if we have questions, ask physicians or do our own research, it would be so nice to be able to work with other people who are nurses and kind of, have discussions about these topics and be like, hey, what kind of management do you guys do for strokes, or what do you guys do for heart attacks, or what has the research shown for you guys regarding code teams? And then being able to build off each other, because I think it's so important to learn from each other, and I feel like that's one of the huge parts of nursing school. And obviously working as a nurse, you have to work as a team, so I think pulling those aspects in of teamwork and like learning from each other into the classroom for your BSN instead of just focusing on maybe some of the more fluff classes, I think that would be huge, and I think that would be truly a benefit to nurses everywhere, whether you work in oncology or the emergency department or on the floor. Just building on those skills, I think, would be huge. I guess now I will open it up for questions and answers. I did think of some questions and answers with some coworkers of mine, and so I'm just going to address those. The top question that I had was, do you think that we should, at our place of employment, extend the time that it takes for someone to get their bachelor's degree? And my answer was yes. I think it is important that an employer works with coworkers to ensure that they are having a good work-family life balance. And with that being said, 4 years is not a lot of time to get a bachelor's degree, so I think even by extending that to 5 years would be beneficial to our organization. Another question that I had that I thought was super cool was, do you think that we should be grandfathering in our nurses who have worked for 15 or 20 plus years and kind of setting an example for that? And, I didn't really find too much research on that. I had a kind of a hard time with that, but I'm going to answer this with my own personal opinion. I think that we could grandfather those nurses in, because I'll tell you, the nurses that I work with that have been nurses in the emergency department setting, or in any setting for that matter, that have been working for 15 or 20 years, they've seen a lot of stuff. They are smart cookies. They have done their research. They have helped grow many, many, many new nurses and have stumbled along the way, have learned from their mistakes, and I think are able to provide this exceptional patient care. So I think that nurses with 15 or 20 years of experience should certainly be grandfathered in. So with that being said, I am going to wrap up this podcast. If you have any other questions, certainly feel free to reach out to me. I've never made a podcast before, so yay, this is done. And if you have any comments, concerns, if you have any critiques for me, I'd certainly be happy to hear about them. And I'm pretty excited. I think that maybe I'll make this a new thing and talk about topics in healthcare. So I hope you'll be able to follow me, and I hope you enjoyed this mini episode. Thanks so much.